I'm here today with Dr. Ritu Chopra, board certified plastic surgeon from Beverly Hills. Welcome to The Face.
Thank you. Appreciate you having me on.
I was so fortunate to meet you at Dr. Ben Tully's conference, Cupid Compendium, late last year, and I invited you to be on the podcast, so thank you so much for joining me.
Yeah, thank you for having me. It was great to meet you. I mean, you walk in the room, a 6-foot Australian, you're like, what is she doing here? And then, and we spent a lot of time on stage together talking about really great things, and it's great to be back with you.
Yeah, that was a great panel. I think it was the regenerative medicine. Yeah, there was so many different participants, so it was a very long conversation.
Yeah.
But something that you're quite passionate about as well in your practice.
Yeah, I mean, I think the building blocks of a great surgery is making sure all the things before surgery are in place. So your skin's looking great, your nutrients are on par, you're exercising, you're sleeping, you're drinking enough water. Once those things are in place, then the surgery should take place. So that's like regenerative medicine, right? We want to make sure that things before surgery are great, and then after surgery to make them even better.
In terms of your career pathway, you're born and bred in Los Angeles, which is quite rare, as we spoke about. Grew up here, and then you started in studying civil engineering, which I had no idea until I started researching you, which was quite fascinating. So how did you end up going into medicine?
That's a great question because, I was born and raised here, born in Santa Monica, raised in Palos Verdes and still live there. My dad was an engineer. So essentially you have two paths if you're Indian. Either you're going to be an engineer or a doctor. So I'm sort of like my parents' wet dream, right? Because I'm an engineer and a doctor. And so, I went to college thinking that I'm going to be an engineer like my dad, and it was just so boring and so painful. But my grandfather was an Ayurvedic doctor.
Really?
And so I've always had a sort of an inkling towards medicine. And so I told my dad, I said, hey, I really want to do medicine. He's like, all right, do it. And he totally supported me all the way through.
So you fully qualified as a civil engineer and then decided at that point, no, I will be a doctor.
Totally.
So you started your study here?
I did.
Yeah.
So, I did civil engineering for like 5.5 years because I was a little bit of a delinquent in college. I was in a fraternity, I played soccer, I surfed a lot. And so it wasn't great the first couple of years.
Sure.
Then it got better. And so I did civil engineering, and then I went to Boston University for medical school. So I went to Boston University first, and then I did my general surgery at Cedars-Sinai here in Beverly Hills.
Right, okay.
And then I did my plastics fellowship in New York City.
So Los Angeles to New York, both so different. What was good and bad from both?
So I thought New York was going to be great, but on a fellow salary, all my money went to my rent.
Okay.
So I really couldn't do much. The people were a bit different. I'm sure you've seen that. Like when I'm walking around, LA, I'm saying, hey, hi. I don't even know them. I'll say hi. Hey, how are you doing? In New York, I did that, and people wanted to fight me. Like, what do you want? You know what I mean? And so New York's a tough place to live, just to even do your laundry or go to the grocery store. But it was a wonderful experience. A lot of talented doctors there, and I got a really good education there.
Do you think it shaped you, like, to come back here to start your career?
No, I think I left before it made me too hard.
Okay.
Like they say, stay in New York too long will make you too hard. Stay in San Francisco too long will make you soft.
So I want to take it back a little bit because we've sort of jumped ahead to your fellowship in plastic surgery in New York.
Yeah.
But before that, you were actually involved in emergency medicine. So take me back there.
That's right. So I started my general surgery at Cedars. And what happened was that one of our residents unfortunately passed away. And because he passed away, that meant we had extra work. And the extra work consisted of being on call every other night.
Okay.
So I was up at 4 a.m. when I wasn't on call, staying to 8 or 9, and then being on call the next day and over again. So to me, it got really hard. I'm like, I can't do this for 5 years. And so I went to emergency medicine at UCLA.
All right.
And so I went to UCLA, and no offense to any emergency medicine doctors, but you're sort of a jack of all trades, and there's not a ton of respect for emergency medicine doctors. And I thought, all the interesting cases that come in, you're calling someone to take care of it.
Sure.
you're calling the general surgeon, you're calling the plastic surgeon, you're calling somebody else to help you. And I didn't like that. And so I called my residency director up and I said, hey, I made a big mistake. He's like, we love you, come back. So thank God he took me back and I finished general surgery and then went to plastics.
So why plastics?
Yeah, that's an interesting question because I actually did trauma critical care. So I did some critical care. I did 12 months of critical care because I thought I wanted to do trauma and critical care. You can see there's a pattern. I don't really know what I want to do, right? So I did that and I thought about it. Do I want to be, a 45, 50-year-old surgeon in the middle of the night doing gunshots and things like that? And I said, that doesn't really cultivate a family, this and that. And so plastics had everything. Plastics had sort of the right brain and left brain, right? You can work both. I can use my civil engineering, but also you can use my artistry as well. So that's why I sort of gravitated to plastics.
So you came back from New York after your fellowship, and what happened then? Did you just decide to set up your own practice? Did someone mentor you?
Yeah.
How did this happen?
That's right. So everyone thinks you've made it once you get to plastic surgery and you finish your fellowship, but it's not even close. You have to spend like 10 years making your name for yourself. So what I did before I left New York, I think I sent out 1,000 resumes to doctors up and down the coast of California with my now ex-wife. I appreciate her for doing that.
Right.
Because she helped me out a lot. So we sent 1,000 out and I got a call from Dr. Orden, and Dr. Orden was the host of the Doctor's TV show,
Right.
a plastic surgeon. So he hired me because he was going to start the show the next year. And so that just gave me this huge boost because I was on the Doctors every other week.
Oh, that's
Oh,
fantastic.
it was huge. So I got this jump start, but I got really lucky.
Yeah.
It's like the right place at the right time.
What was that like, being on reality television?
It was great. I didn't know any different, but
Yeah.
it was awesome. Like he's a ham for sure. And so I was just his sidekick. I would do all the operations. And then I was actually the plastic surgery correspondent. So I would go to different plastic surgeons. I would interview them, do different sort of surgeries with them. It was great. Everyone on the show was wonderful.
Wow. So from that, getting your name out there, you set up your practice in Beverly Hills.
With him, yeah. So I have a practice in Beverly Hills and also in the desert in Rancho Mirage.
Right.
And so it's awesome. We have the best of both worlds. In the desert, that weather's probably the best from December through February. And then here we have the beautiful summers. So I
Yeah.
love to golf, I love to surf. So it's like a perfect place.
I love having the two practices.
Yeah.
So in the country, and I love going home, and it's so grounding and nature, and I exercise, and then I go back to the city. So
Yeah.
I'm based in Toorak, which is kind of like the Beverly Hills of Melbourne.
Okay.
So then I get the exact opposite, cities, restaurants, like events. It's so fun to have the two.
Yeah.
Yeah.
Yeah. It's a yin and yang.
Yeah, the yin
right?
and yang. I think it's really good to have the balance.
100%.
So you're working as a plastic surgeon,
Yes.
you've finished the doctors, and
Yes.
then how did you become really interested in facelift surgery?
Yeah. So Dr. Orden from the beginning was doing facelifts. So he is he is an ENT trained, and then he did plastics on top of it. So he's not only, facial plastics, he's also plastic. So he did essentially two residencies. And so he was doing facelifts from the get-go. So I was doing them from the get-go. And then I got better and better. And, to be honest, I met a really good friend of mine, Ben Talley, and he was like, your facelifts are so good, you should just really concentrate on doing facelifts. And he was the one to really sort of push me into it. And we collaborated a lot. He has taught me a lot of things on a lot of different things about the face. And it's only accelerated my career. So I owe Ben a lot.
When I interviewed Ben the first time, he spoke about that. He spoke about there was a group of you that just got together and leaned on each other and taught each other and spoke about your mistakes. And that's really how you guys have taken it from here to here and really grown your practices.
I think that is so true because everyone's competing, When you're at the lower level, you're competing. When you're at the top level, you're collaborating. And that's what we're doing. I'm looking at what Mike Nyack's doing. I'm looking at what Tim Martin's doing. I'm looking at what Ben's doing. I'm looking at what anybody's doing to make me better. And everyone's doing that. So now you see this rise in facelift and how good they are. I mean, there's a lot of bullshit going on with Kris Jenner and shit like that, stuff like that.
Yeah.
With the Photoshop and stuff.
It's hard. It's really difficult because from a non-surgical perspective, the
Yeah.
Kardashian culture has always really
Yes.
affected my business because
sure.
when, the lip kit came out, and obviously, they are in an income bracket to be working with the best people and having surgical procedures, not
Yep.
just non-surgical procedures. So there was, such an enormous amount of time people were spending online during COVID.
Yeah.
And then post-COVID, when everything opened again, patients were very naive to think that they would receive surgery-like results from non-surgical procedures. So it was this, a really difficult time to sort of re-educate patients that,
Yeah.
you can't get that with a syringe,
Yeah.
and that there wasn't a lot of transparency. But now there is transparency, but there's also a lot of filtering.
Yes.
So talk to me about that. How has social media affected your business and your career?
So it's a double-edged sword. So obviously it's great to have my before and afters out on social media, and it reaches a ton of more people than I ever could. But on the flip side, you're absolutely right. The filters, the changing in lighting, the different positions, the makeup, all that stuff gives these huge expectations. Because listen, Kris Jenner is beautiful,
Very.
but she doesn't look like her filtered pictures. No 70-year-old does. No 70-year-old has perfect sort of cheek area to eye area or no pores, right? No one has that. A baby doesn't have that. My 4-year-old doesn't have that. So there's no way she can have it. She's beautiful, but she doesn't look like what she portrays.
I feel too, there was a lot of hype around the particular surgeon that performed the operation. Do you think, in your opinion, she may have received that result as a secondary facelift anyway?
Yeah, so I think, Steve Levine's a great
Incredible
surgeon. Yeah,
surgeon.
he's a great surgeon,
Yes.
nice guy. He has everything about him. And I don't think it's about Steve. I think it's about being really good at the technique that you're really good at.
Yes.
Steve's great at doing a mastectomy. Other people are great at doing a deep plane. I think in terms of physics and engineering, since I'm an engineer, the best facelift for longevity is the deep plane. Does that mean you can't get great results with a mastectomy and a high smash? No, it means you can. But if you're looking for durability and naturalness in just terms of plane physics, a deep plane will make you last the longest. So to your question, yes, I think she probably could have got that result from going to another super gifted surgeon.
Because do you think that the secondary facelift, if it's done really well, could even be better than the first one?
Yeah, so it depends. So if someone's doing, say someone does a plication or a mastectomy first, they've taken essentially the skin laxity out because they really try to pull on the skin. So if you now go in with a deep plane and actually rearrange sort of the deeper layer, you can get a beautiful result because the skin has already been taken up.
Yes.
And now you're just really restructuring everything.
Yes, because I think it was about 14 years between her first one
Totally.
and her second one.
Perfect.
Yeah, she looks amazing.
She's beautiful.
Yes.
And I'm not saying she's not beautiful. I'm not saying the surgery's not great, but it's just the portrayal of it is just not realistic.
No, it isn't.
That's the big problem.
Yeah, it isn't. And I feel, Ben even spoke about this on the podcast when I interviewed him. They own the media. So
Yeah.
they have a say in every single photo that goes out. So every single photo can be filtered if that's what they desire.
Yep.
So the public just do not get a realistic expectation.
No, but you've seen some candid pictures of her, and I've seen her. They're just two different things.
I love the fact, though, that it has opened the conversation for facelifts, because I started my career in 2004 with Brian Mendelsohn.
Yeah,
So
one of the pioneers.
one of the pioneers.
Yeah, absolutely.
But in 2004, there wasn't any social media, but still, 4 days a week in his surgery, someone was getting a facelift,
Yeah.
but no one spoke about it.
Yeah.
So now I think it's wonderful that people are seeing what can be done. They're open to talking about it, and they're more inclined to say, you know what, I think that that's the decision I may, or the pathway that I may take.
Yep.
So has it increased your business in this time?
Yes. I mean, we owe a lot to people like Andrew Giacono,
Yes.
because he has really sort of elevated sort of the facelift, and especially the deep plane. But now Steve Levine, all these other people, Mike Nyack, Ben, everyone, all of us have sort of elevated a facelift to a topic that everyone talks about now. It's not taboo. And it's okay to want to look good, right? There's no shame in that. Everyone says, oh, I want to age naturally. Wonderful. But you can still age naturally and get a beautiful facelift.
On any given day, if a conversation in my clinic is around a facelift, often what women say is, oh, I just want a mini lift.
Yeah.
And I've said this on about 5 different podcasts.
Yeah.
I feel like they think maybe it's too vain to say they want a deep plane facelift or a smash facelift.
Yes.
So can you talk us through, firstly, your technique, which is the Define facelift, and then in comparison to the smash facelift?
Yeah, so my Define facelift is sort of an acronym. It stands for Deep Plane, D, extended facelift, including eye, the neck, and elevation of the brow. So I lift the face, the neck, and the brow all together because they operate as a unit. The brow has ptosis, and they're on the deep plane, the cheek, the jowls, and the neck. So I lift it all together. I think how it differs from a mastectomy is kind of technical points in the sense that I'm releasing all the ligaments underneath the smash, so it's fully mobile and moving gracefully without any tether points. And I'm not relying on the skin at all. So it's a purely structural lift, and it comes up in the plane that it sort of drooped. So our face is drooping sort of pendulally, and we're lifting it back up just like that in a beautiful way. It lasts the longest, and it's the most natural. I've done plications, I've done mastectomies, I've done the high smash, and I think in my hands, that's the best facelift.
The Define, the deep plane.
Yeah, so it's just an extended deep plane, which the majority of us are all doing, and there's different names for them.
Yes, there are.
Vertical restorer, there's the aura lift, there's the omakase. It's all essentially the same thing, except with the surgeon's sort of sprinkling of magic.
But why do you think patients say, I just want a mini lift?
Yes, I know, that's an interesting thing. And so if you need a facelift,
Yes,
you need a facelift.
exactly.
Period. Very rarely do you need your face done and not your neck done, right? So a mini lift in my mind is really only lifting sort of your lower facelift, and that's it. I don't do mini facelifts. Either you're a candidate for a facelift or you're not. But you're right, there's a stigma to women saying, oh, I just need a mini. It's like, there's this much difference between the incision between a mini lift and a full facelift. And you're gonna get so much more bang for your buck. So
Yeah, let's talk about age for a moment, because there is a misconception on when the perfect age for a facelift is. When I worked for Dr. Mendelsohn, he explained to me he felt 42 was a good age because, you know, the hormones have started to change, and it would be an age where no one would ever know, and you would just age very gracefully in the jawline area. However, you know, 42 to most people sounds very young. Okay, so talk to me about your age group and your demographics in your practice.
That is really an interesting thing, because Dr. Mendelsohn's obviously a little bit older, and for him to come to that sort of conclusion means a lot to me, because I actually agree with him. There's no real age that's facelift appropriate. So there's women in their 30s who've lost a ton of weight, or who genetically have thick necks. Those can benefit from that. But I think, to Dr. Mendelsohn's point, I think you're right. I think for me, the ripe age is sort of late 40s to early 50s, because their hormones are changed, but your elastin, your collagen, your volume is still pretty good. And we do this, you're gonna have a longer lasting use out of it, right? So it'll last 15 years, you're gonna look like you're 30 for 15 years. Like, who doesn't want that?
Absolutely.
I mean, you look like you're 20. So.
Thank you. That's very kind. I wouldn't go that far. I don't feel it. With a mother of 3 boys, but you know, I'm fit and healthy, and that is the main thing.
Yes, knock on wood.
Let's talk about longevity. So, if a patient has a facelift, their first facelift, when would you be seeing, with your particular technique, which is the Define facelift, someone that would need a secondary facelift?
So that's a very interesting question, and so that comes down to, how are the materials before I start? Are they a little bit overweight? Do they smoke at all? Do they have bad sun exposure? All those things matter, because the structure of when I'm moving, the smash, the skin, the fat, that matters more the actual technique per se, right? So if a person was pristine, didn't get any sun, never lost weight, that's going to last 15 years. Person on the other hand, if they're a little bit older, had bad sun exposure, had fluctuations in weight, doesn't take care of themselves, maybe that's going to last 7 to 10 years. So it depends on the materials I'm using, because with a deep plane facelift, I'm releasing everything, so I can release everything, put it back up in a beautiful way. But if the materials I'm using aren't great, that what causes the difference in longevity.
What age, would be the oldest patient that you've looked after for a first facelift?
Yeah, for a first facelift, I've done 70s, 75s,
Yep.
but I've done 80-year-old revisions because my practice in Rancho Mirage,
Yes.
that's an older community where they're facelifts from, I don't know, probably from the 60s, which are just bad.
Yes.
And they look, and that's what gives plastic surgery a bad
does.
name. It's the ones you see that look like this because that's what they were doing back then. That's what gives plastic surgery a bad name. But I've done 70s, I've done 80s, and I've done as young as 30s.
I want to get into weight loss a little bit later because
Yeah.
that's a great topic in terms of the
Ozempic
acceleration of patients needing a facelift.
Yeah.
I have a patient recently who's been seeing me for the past few years for non-surgical treatments. She has lost an enormous amount of weight, and I mean enormous amount of weight very, very quickly.
Yep.
And what I can't get over is the crepiness of the skin. Can you talk to me about that with the GLP-1s? Why would the skin be crepey?
Because imagine you have, I think the best analogy, those big trash cans, trash bags. So you fill those up, right? You fill those up with trash, and now the outer coat of that trash bag is really shiny and taut. You take some trash out of it, and what happens? You get all these folds in it. And that's exactly what happens to the skin, because the skin needs some of that fat and structure to actually keep it nice and not crepey. So especially when it comes to the GLP-1 people, when they're losing so much weight rapidly, that's the whole problem. If they can sort of space it out and make sure they're eating a lot of protein and working out and make sure they're not losing their lean body mass, they will look a lot better.
No.
That's the problem.
Because they're also losing the fat pads in the face and the muscle in the face.
That's the problem, right? So you're losing that lean body mass. So with retatrutide, the new one, you're not really doing that. But the Ozempic, you definitely lose lean body mass, and that's the problem.
Because it's quite a shock, because obviously biostimulation would be appropriate.
Yep.
But you can't fill them either because they look...
They're an empty bag.
Exactly.
And that's a lot of filler. So they need a hybrid combination like you were talking about. They need some filling.
Yes.
They need the texture being taken care of with a CO2 laser or a peel or whatever you want. And finally, they need the laxity taken out. So you have to address aging. And in general, there's 3 big things, like we just said: texture, volume, laxity. You address all those things, you'll never look weird. You'll look just rejuvenated.
I interviewed a plastic surgeon in Australia recently, and he said his oldest patient was in the 80s for a first facelift, and she flew right through it.
Yeah.
I had a patient when I was working for Dr. Mendelsohn who was 75, and she had lied to her family about where she was, and she had an amazing result. It was the lower face and neck, but she mentally didn't cope very well, I think because she was keeping it a secret, and there was all this external pressure. How important is family support with plastic surgery?
Huge.
Yeah.
So if we were talking about what are the most important things to get you through a surgery, I think being as healthy as you possibly can, and then having support structure.
Yes.
You really need that. And the worst thing is that, you have kids, say they're 13, 14, especially a little girl, they'll go to their mom, "Mom, you look funny. Why'd you do this to yourself? You don't look like my mom." And then they freak out.
Yes.
They come in your office and they're freaked. "My daughters don't think I look like myself, this and that." I said, just give it time. You're going to look beautiful.
And they're also trying to recover.
Yeah,
it's a big process.
That's a great point, because people think elective surgery is elective surgery and easy. A big facelift, eyes, lip lifts, it's going to take you a while. You're going to look like a monster for 3 weeks.
Yes.
You are.
So would you advise how much time off work?
Yeah, at least 3. So I tell people 3.5 weeks are public ready. And when public ready, I mean you won't scare somebody at the store. When you get to about 2 months, you look awesome. 6 months, you look amazing. And at 6 months, you're still healing. At 6 months, you're maybe 60% healed. And all the healing on the inside is going on. When you get about 8, 9 months, you're about 100%. So it's almost like 10% per month that you're healing. First month, you're only 10%. So people come to me like, I look swollen still. Yeah, you're only 10% healed.
One of the most fascinating things I learned when I worked for Dr. Mendelsohn was before and after photography.
Oh, yeah.
And how different the patient looks, because it's a long year. So we take the before photos, and then we would take 4 months post-operatively, and then 12 months.
Yeah.
And the difference between 4 months and 12 months was so significant. How do you educate patients that this is just not going to heal overnight? And
So hard.
yeah,
I tell them over and over again. And then they still come back with the same questions. No one told me it's going to take this long. Yeah, we did. We did tell you. We go over it every time. But people want to hear what they want to hear. And that's sort of the job that we have to sort of get through and try to educate them even more. But we do it every day, and they just, either they don't want to listen, sort of benign neglect. Right?
I have to say, I really like watching your socials.
Mine?
Yeah, I do. I feel like you're very natural.
That's really
I like
sad.
it when you come onto the screen and you're saying, today we're doing this.
Yeah.
I think it's really important to, obviously educate, but I feel with social media, I mean, I know I get so sick of doing social media. I have this love-hate affair with it.
Yeah.
So some months I'm excellent and I'm posting all the time, and then other times I don't post for 2 months, which I'm in at the moment.
Yes.
But I feel like if you can just grab the camera and educate like you've been doing, it's so good for people watching.
Well, I really appreciate that, because everything you see on mine, I do it myself.
Yeah.
Which is sad that you think it's good.
No, I do. I think it's great.
But yeah, I do it all. But you're right. It's a pain in the butt. But I want to educate people as much as I can. I don't have a big crew like a lot of other plastic surgeons do. I just kind of put it on and do it.
Yeah.
And I do think it's more authentic that way.
I do too.
Yeah.
I also love the way Mike Nyack,
Yes.
he shows it just the ugliest side.
Yes.
There is not one thing glamorous about this process.
Yeah.
He's showing the patient day one post-op, after the CO2, and they're looking absolutely frightful.
They are.
And then it's this whole process. But I feel that's why we're in such a good time on social media, because the transparency is real.
Yeah.
And if you want to talk about authenticity, I think that's a really good way to educate people.
Yes, I think you hit it on the head, because right now we're in this great area of transparency, but then you can flip it and you look at other people's where they're sort of changing, they're filtering their before and after, they're doing this, they're doing that. Because listen, no matter how good you are, you're not going to be an expert in 5 years.
No.
You're not going to be an expert in 7 years. It takes you 7 to 10 years to get really good at something. It's just like that book, that 10,000 hours. To get 10,000 hours to become an expert in facelift surgery, that's going to take you 10, 12 years.
Well, when we were researching you, because I've been researching you with my 18-year-old son, because he was helping me.
Did he find any
He just,
bad stuff?
I think not at all. Is there bad stuff?
No. Is there?
He couldn't get his head around the fact that you guys do not qualify really until you're almost in your 40s.
Yes.
And he was like, but it's just taken them so long. And I said, but you can't expect to be able to operate on the general public at this sort of extensive knowledge and experience and expertise without putting in this long journey of study and education. So I thought, that was really interesting for him to hear that if you want to be good at something and if you want to go for the distance, it takes a long time to get there.
I think that's 100% right. You know it too, though, because you've been at this for a while, right? Because there's no easy way to be successful. And it's sort of a little bit off of the topic, but you have to sacrifice things. I mean, we've both been there. We had to sacrifice some things with the family. Like, I'm not there for my kids' stuff. I'm definitely not there enough for my wife.
It's a huge amount of time.
Right, and nobody knows that unless you're in the field. And unless you're, like, you worked with Dr. Mendelsohn, so you saw the stress on him and from the patients and the constant sort of hand-holding that you had to do, right? It's a lot of pressure, especially taking a healthy person. Right? It's different when you're taking their appendix out or the gallbladder. It's fine. But when you're taking someone who wants a facelift, you're taking a healthy person and messing them up surgically and hoping it comes out great on the other end. So that's a lot of stress.
It is. And it's also what was so fascinating with working for him, which has really influenced was the business side of things.
Yes.
The flowers, the lighting, the carpets, the way we spoke to the patients on the phone, the following up. I mean, no quicker way to lose a patient than not following up.
Yep.
And I've learned that lesson the hard way. You know, we've never been better at putting in these processes where we're constantly checking on our patients and making sure that they're happy and that they're fine. But, you know, you've also got not only the medical stress and executing to a high level, then you're actually running a business as well. So talk to me about that. How did you learn how to run a business?
So lucky for me, I enjoy that. But when I joined Dr. Orton, and I love Dr. Orton, but he wanted to be more of a TV star than, right, so great. And so he's like, it's all yours. So I was kind of running the business, doing this, doing that. But it's very difficult. They don't teach you any of this in medical school. And now I've grown the practice 5 times.
Wow.
I've hired an associate 5 years ago, and I'm hiring my second associate this July. And so now I'm sort of transitioning. So it's hard. So right now I'm sort of at the top of the food chain, at the peak. But I'm actually transitioning into more of the business owner and sort of helping my guys with their cases, right? And I'm enjoying that. I think it's a nice transition.
I love that you give back. So tell me about the Keck. Is it the Keck Fellowship?
Yeah, so I'm one of the co-directors of the Keck Fellowship. So we get 2 trained surgeons from all around the country that stay with us, myself, Dr. Calvert, Dr. Gavami, Dr. Macias, Dr. Perez, Dr. Villanueva. We all have this fellowship, and they stay with us for 3 months blocks. So they each stay with us for about 6 months. And so I teach them a lot about facelift. Dr. Calvert teaches them a lot about noses, and Gavami a lot about noses. But it's really sort of the top fellowship in the country.
Yeah, wow.
Because everyone wants to come to LA and be trained by
of course.
Beverly Hills surgeons.
Absolutely.
Yeah, so we've been doing that for 10, 12 years. It was started by Grant Stevens. We kind of took it over. And it's been great. There's nothing like, you don't know something until you can teach to somebody. Once you can teach it to somebody, then you really have it down. Yeah.
I did find that recently. Allergan in the USA had me out here last November just before I met you, to go into different clinics around America and teach non-surgical clinicians.
It's amazing.
And never a time have I learnt so much as when I was teaching other people. It was so good. I came back to Australia and I've implemented all of these new things in my own practice just because I've had the experience of teaching other people.
Yeah, I think that's right, because everyone has something to offer, right? They have a little tip. Even if they're not an expert in it, you can always gain something. And I think this is really important. There's plastics, facial plastics, oculoplastics, right? Everyone, well, I should say, plastics is generally thought of as sort of the top of the food chain, then facial plastics and oculoplastics. However, if you are open-minded enough to hang out with other people, there's a million facial plastics, well, not a million, there's a lot of facial plastic surgeons who are just as good or even better than plastic surgeons. There are a lot of oculoplastic surgeons who are better than plastic surgeons in the eyes. So what I try to do is not only teach, but I try to learn from other specialties. So I love my oculoplastics like Guy Masri, Kami Parsa, both very dear friends of mine. And then, you know, facial plastics. And we all, like we talked about before, we all sort of add our ideas and everyone gets better, just to your point.
Absolutely. I saw Dr. Mendelsohn a few days ago. Him and his wife stopped by my clinic.
Oh, really?
It's so surreal.
Is he still practicing?
He isn't. He's just retired.
How old is he now?
He's in his 80s now.
Holy moly.
And it was
But shoot me if I'm practicing then still.
He looks amazing.
Does he?
Yeah, absolutely. He's so fit and healthy.
Good for him.
And we were having coffee and, you know, always the conversation will steer towards facelifts.
Yes.
Because he just lives and breathes his work. And he said, there's a big difference between a facelift and an exceptional facelift. Talk to me about that.
I think the details are where it happens, the beauty in that. And you have to be able to look at a face, and everyone has a sort of different eye for beauty, but you have to see what makes someone look pretty. people's brows are going to be different. People's cheeks are going to be different. People's jawline, and you have to curtail it to their face. You can't be cookie cutter. But the details in how you place the sutures, the vectors that you use, changes a procedure from sort of a structural to a beautification. Lifting the brows in a beautiful way, or relocating the brows, adding just a tiny bit of volume, doing this little things like a tiny lip lift or ptosis repair for the eyes. That all comes together to make a facelift, an exceptional facelift. It's really in the minute details.
I want to talk about respecting a person's ethnicity, as Australia's had this huge resurgence of younger women going to Turkey. And it's not that the surgery isn't of a high quality, it's that the ethnicity isn't matching their Caucasian appearance in a lot of cases, coming home, and then obviously their family members are, you know, a little bit shocked that the rhinoplasties are maybe perhaps overdone and the brows look
a little high.
Just
a little.
So how do you really work with a person's natural features?
So I think the most important thing is to have that open dialogue between you and the patient, and making sure you guys are both on the same plane. Because if someone comes to me and says, "Oh, doc, I really want to have a fox eye. I really want my eyes up and you know, at a vertical or whatever horizontal angle," and I'm like, "I'm not your surgeon. I don't do that kind of work." Go down the street, go to Santa Monica. I know a couple of guys, but that's not for me. So I really try to keep the face balanced and in harmony to them. And I think it's asking them what they want, what are their expectations, and then really working with that. But I do not like changing the way a person looks. I just like make them prettier. And I tell people that. So when they come in for a facelift, like, how many years am I going to take off? I'm like, I don't know. I'm really not trying to take off years. I just want to make you look prettier. And they're like, okay, great. That's what everyone wants to look. They just want to look prettier. I do.
Yes, absolutely. Same here. Let's talk about skin quality, because even in non-surgical practice, the skin quality is more important than ever. And, you know, they've done a recent survey that said 95% of people are interested in improving their skin quality. I'm a big believer in skincare, and the skincare market's growing in the billions of dollars every year. How do you incorporate that in terms of your facelift patients?
So I think that's the number one thing I would do before a facelift is get my texture right. Whether it be microneedling, whether it be a great skin regimen, maybe even a little biostimulation, whatever it is to make the texture of your skin more pretty, because that's one thing we can work on without doing a facelift. So all my facelift patients, I incorporate afterwards doing microneedling for them, as well as PRP, as well as, you know, the new ZERF.
No, tell me about that.
So it's a new sort of radio frequency that doesn't go deep, so it doesn't melt any fat. And so I think texture is probably the most important thing before a facelift surgery and after a facelift surgery. So I think just for maintenance, I think it's important to do maybe a CO2 laser every year, microneedling every 3 months with some PRP, and then a wonderful skin regimen with a little bit of glycolic, a little bit of tretinoin, and the great moisturizer and sunblock. I think those are really important. I mean, what do you do for your face? Your skin is like really good.
Thank you. So 12 months ago, I invested in 2 new lasers for the practice. And I feel like that's definitely helped. Nothing aggressive, nothing ablative. Aerolase has been wonderful. And also, you know, just regular laser genesis, regular microneedling.
Yes, I like that.
The other product that we have that is not FDA approved here yet is called Profilo, and it's thermally cross-linked. So it's still a hyaluronic acid. So it's very fluid. So you inject it into 5 different points, and it spreads to a 5 centimeter diameter, and it stimulates elastin and collagen. It's Italian. They've had it in Europe for like 10 years. So Australia is a big consumer of that product, and it's very good for healing the skin. So I do that quite regularly.
And then I've seen that you like the CO2 lift.
I do.
Yeah.
I do love that.
I know you do.
It's great.
And so what do you think about that? Because, you know, I sometimes use it for my facelift patients, and you think it's worth it.
I do think it's worth it. everything looks a lot clearer
Okay.
and less red. So I think for vascularity, it's really good. But I
Okay.
also think for healing, fantastic.
Really?
Absolutely.
Okay.
But I think it's an event ready. Like if I was going to an event, I would
Yeah.
be doing that beforehand.
Really?
For sure. Especially for makeup and everything. Yes.
Okay.
Yeah, I
like
really
that.
think it's very, very effective.
It's good to know.
But I think microneedling is very undervalued.
100%.
Yes.
Very little downside, in my opinion.
Mm-hmm.
Obviously, bacterial infections can happen, but I love microneedling. Plain microneedling, if you want to throw a little plasma on it, fine. But I think microneedling is better than microneedling with RF
Yes.
in terms of texture,
I agree.
only by itself.
Yes, I
Yeah.
agree. We do incorporate the PDRN. PDRN is very, very popular in Australia.
Really?
Huge. Because
Why?
we have very strong social media laws. So we're not allowed to post before and afters. We're not allowed, if I hashtag the word Botox, I can get threatened with a fine. Our government's
Really?
very, very strict. So it'd be very hard for a person to make a name on social media if they're not already established. So we're not allowed to be seen as advertising a medicine.
Okay.
So it's been quite difficult and challenging from that perspective. The only thing that we are allowed to show on our social media, because it's not classified as a medicine, is PDRN. So it's Redurin. So Redurin in Australia just huge.
Why is
But it's
that?
really interesting because patients come in and they say, I want to have salmon sperm. I want to
Yeah.
have Redurin. Well,
Yeah.
it's not big here at all.
Not at all.
And not at all. So it's just interesting the power of social media
media.
again, because we do have many different types of injectable products that strengthen the skin, including Profilo. We are getting a brand new one at the moment that's not here either. So there's a lot of different ones, but everyone comes in asking for
Sperm on
Redurin.
their face.
Yes, they do. So we do
God bless them.
that with the microneedling as well.
Yes.
And also the exosomes with the microneedling.
Yeah. What do you think about exosomes?
I think that in combination with microneedling, it's been
Yeah.
very effective.
Yeah.
I have not injected them.
Yeah, that's great.
No.
Are you injecting the salmon sperm?
Yes.
Yeah, because I thought that maybe in Australia, but here it's off-label to inject.
Yeah,
salmon
it's
sperm.
not there. It's not in Australia, but we inject it intradermal.
Okay.
And but the under eye Redurin
Really?
is very popular. Very, very popular. So it's nice to see, it strengthens the skin, it causes that collagen renewal.
Why does Australia allow you to are they in cahoots with the government?
No, it's just the fact that it's not classified as a medicine because it's salmon sperm. So it's just been this interesting unfolding.
That
And
is
I was
very
sent
interesting.
over there to Korea at the end
Yeah.
of 2024 and
Yeah.
we visited the laboratory and have you been to Korea?
No.
It's incredible.
So you went to the actual salmon sperm?
Yes. They showed us where
How
the
they-
salmons come home. So they come into the factory and they
then-
died. It's their last trip. They've been traveling the world and they come home.
And someone.
Yes, they do. They extract
Okay.
extract
That's
the
I didn't know how to say
the
it. Like
semen.
jerk them off,
Yeah,
or how they,
I'm
you
not
can't
sure.
jerk
It was
off.
interesting.
jerk
Because
off
we
a
had to
salmon,
hand
can
our
you?
phones in. It was very high level security.
Did
But
you get your hands?
we caught
wet?
one. Yeah, we got into the water.
Are you serious?
Yes.
Are you making this
No,
up?
no, I'm not. I'll show you a photo. We
And
all
then
got
you were
into
surrounded with salmon sperm?
no, just salmon.
Oh,
At
okay.
this point, just the salmon.
Thank
And we
goodness.
caught one.
Okay.
And yeah, we were all in gumboots and wet weather
Really?
gear and everything. Yeah, and then
That's
they
really
took us
cool.
into the laboratory and
Yeah.
they in a large bucket they showed us all of the salmon testi, and then they showed us the process.
Do you know that history? Like, how do they ever think salmon sperm would be great on your face?
I don't know, but it's an amazing skincare range.
Is it
it's
really?
incredible.
So if you had to pick one modality, say you were on a desert island and you wanted to keep your skin really good, besides sunblock, what modality would you bring with you? I have mine that I would bring.
Neuromodulator.
Really?
Yeah,
Like Botox?
yeah,
No.
yeah. See how I didn't say the word?
Yes, yes. You're trained very well. They're trained you very well.
Yeah, we have to have on our website wrinkle reduction treatment. We can't we can't even have the word.
So I think if I really just wanted to take care of my skin,
Okay.
obviously sunblock, but I'm torn between CO2 laser and microneedling. And I think I'm leaning towards CO2.
Really?
I do think, because I think you're getting all the benefits of microneedling, plus you're getting a little more stimulation of your collagen.
Yeah, just in a more extreme,
That's right.
aggressive fashion.
And you're going to be by yourself on the island, so who cares?
True. Yes, it's very effective.
Yeah.
Yeah.
You just need downtime.
You do need the downtime. Yeah. So what about skincare? What would be the one? Do you like skincare?
I do. I don't use any.
You don't use any?
No.
What is it with men and skincare? They just don't love to use it.
No. And I think it's a great market
Yeah.
to do it, but you have to make it really simplified. There's a couple simplified ones out there, but it has to be really simplified. No guy wants to do like an 8-step
No.
thing.
I would say vitamin A for me.
Really?
Yeah.
I think, go ahead.
Yeah.
I think that's great, but I think we're moving into a different sort of space where we actually want to treat our sort of the bacteria on our face in a more gentle way.
Yes. That's what I learned in Korea.
Yes.
So I feel like in Australia we have so much sun damage that we were in the habit of stripping and exfoliating and
That's
harsh
it.
cleansing.
That's it.
And when I went there, I realized how much they nourish and heal their skin.
Yep.
It completely changed not only my own skincare routine, but my practice. So it's been really important. Like that trip was so important because I learned so many things. But that's why I love the Rajuran range, because it's so healing and luxurious, and it feels like your skin is healing. If I can
I think
explain
that's
it like
right.
that.
And I think Western medicine, unfortunately, has taken the stripping, the peeling too far,
Yeah, aggressive.
too aggressive.
Yes.
And we just need to nourish the bacteria we have on our skin.
Yes.
If we do that, you're going to have a really healthy skin. And to your point, you need to nourish it. You need to feed it the right things, and your skin will glow. You don't need to strip it away. I think, like you said, I think vitamin D is great for wrinkles, but it has to
Yes.
be really used sparingly.
Very
I think vitamin
sparingly.
C is great, but
Yes.
that's a little caustic.
Yes.
All those things, I think we should move more to a, like you said, a nourishment kind of an approach. I think we do that for our bellies, right? We should do that for our face.
Yeah.
Yeah.
Let's go to longevity for a moment, because
Sure.
I know you're into health and fitness and you do surf.
I do.
And you grew up surfing.
I have.
How does that play into your surgical day? Do you think it helps?
Yeah, I think having an outlet, whatever that may be, to get you to your Zen moment is great. And for me, that's surfing. The only issue is, because I'm like so type A personality, that if I don't surf well, it makes my day shitty the whole time,
Right.
right? I can't just go out there just to have fun and surf. I can, but if I'm not surfing well, it's a problem. I sort of have to work on that and
So
work on my ability to sort of
Enjoy
it.
And that is my next question. If you weren't a plastic surgeon, what would you still be obsessed with perfecting? Because I can tell that you are that type A personality.
If I wasn't a plastic surgeon, let's do that. If I wasn't a plastic surgeon, I would definitely be a firefighter.
Really?
Yes, because I want to hang out with the guys, work out all the time, and then help people. That's like a great job, you know?
Yeah.
And that's what I was thinking before I left college, would be a firefighter. But then, you know, there's very few Indian firefighters. That's either a doctor or an engineer, so I want the doctor route.
Just to wrap up,
Yes.
what are you excited about? What's next for Ritu Chopra?
Well, I'm excited about this podcast.
Yes.
That's
Good answer.
Seeing you with your Erewhon smoothie, that sort of made my day.
So LA.
So LA. I'm like, oh my gosh, she spent $90 on that.
Seriously. Oh, I had to buy my son one too.
Yeah,
so it was
exactly.
a lot. We actually went to the checkout.
Yeah, and you're like, what?
And I went on, and he was like, we just started laughing.
Yes, it's crazy.
It was.
You know, my next transition is going to be even more putting myself in situations where I can help future surgeons. I think I've been blessed. I'm grateful about all my mentors helping me, and I want to help. I'm luckily in a good position that I can do that. And so I want to grow the business with my junior associates and make people happy, make them happy, make the people that work for me happy. That's what it's about, right?
Yeah, absolutely. Thank you, Dr. Ritu
Thank
Chopra,
you.
for joining me on The Face.
I'm stoked to see you.
Thank you.